on the US infant mortality rate, Dr. Omer Awan joins us from Baltimore. He's a physician as well as a senior public health contributor for Forbes magazine. Great to have you on the show today. Now, infant mortality rate is at its lowest ever, but still behind in comparison to other wealthy countries. Is there a specific data or reason why we have now dropped to this lowest level? Is there some sort of encouraging evidence that would suggest a continued downward trend?
Well, this last year we did make progress, and I think that's important to recognize and celebrate. And the reason the United States has made progress is because we've invested in a lot of public health interventions and measures, particularly with screening. We've strengthened our screening programs, and when we increase screening, we identify high-risk pregnancies, and we can treat that in time, and then that improves outcomes. Also, we've made significant progress in treatment, particularly in neonatal ICUs, and particularly premature births. And as you know, premature births are the leading cause of death for infants. So even decreasing premature deaths by a little bit will have significant improvements in infant mortality. And then, as was stated in the video right before this, was, vaccination campaigns, not only RSV, but even COVID and flu. As more mothers get vaccinated, then that immunity gets passed on to infants, and then there's increased improvement and increased progress. So for these reasons, this is why we've made some progress in this last year.
There's a lot of contradictions, though, in that, and there's several points I want to get to in just a moment. But first, perhaps the most important part of this story is that death rates for infants born to Black women are more than twice as high as those for the infants of Hispanic, white and Asian American women. Talk more about the complexity of why that is.
Well, it shows that we have a fragmented healthcare system in the United States. That's essentially what this means. We have a lot of unequal access for women with healthcare. I mean, there are 10 million American women that don't have access to healthcare. And then, as you stated, Black infants are at least twice as likely to die than white infants. And the reason for that is not because of the color of their skin, but it's actually because of structural inequities, because of structural racism, because of the fact that Black Americans don't have the same access to healthcare that white Americans do. And that's deeply problematic. And that is something that has been a problem with the American public health infrastructure for decades. And this is something that we certainly have to start improving as time goes on. It's very important that we address this. And this is seen very readily in infant mortality. And infant mortality is actually a very good measure for a nation's overall health infrastructure.
Yeah, I mean, I've interviewed women not just from lower socioeconomic backgrounds, but also Black women of very much middle-class communities who face the same issues, especially in regards to pain medications in hospital, for example. But just to touch on one of your earlier topics, you talk about how we've made advancements, but here we are in this period of politics. The Trump administration has shifted away from prioritising maternal and infant health equity. On top of that, we've got Robert F. Kennedy Jr.'s leadership of the HHS promoting health misinformation. Talk about how this political climate impacts Black women, particularly giving birth today.
Well, it has a significant impact for Black women particularly, because if we don't invest in them, then health outcomes remain poor. Public health only works when everyone gets access to healthcare, and that includes Black Americans, Hispanic Americans, white Americans, all types of people. It cannot be favored towards one race or towards one people. And then, the disparities aren't just about race, and I want to make that clear. These disparities are about income as well. Income plays a huge role. Income, affects our ability for housing, for nutrition, for transportation, for our ability to even go to a doctor's appointment, for our ability to access medications. For poor people, they don't have the same access as wealthy individuals. And there are 19 million Americans that are at the poverty level. That's an astonishing number. That number doesn't exist in other developed nations. And this is also part of the problem why we have worse outcomes, despite the fact that we pay much more for healthcare than many of these other countries. So this is also deeply problematic from a public health perspective.
Unfortunately, I can't continue the interview. I've got to head off. But Dr. Omer Awan, I really appreciate your time. Thank you.